All right, good morning. Thank you everyone for joining us today. We're here this morning to discuss the new order on essential and infrastructure workers. Thank you to our media who have dialed in this morning, and we have our three experts here in the room with us, as well as one online. So with us today, we have Premier Caroline Cochrane, Minister Thom, Minister of Health and Social Services, Dr. Kandola, Chief Public Health Officer, and then dialing in on the screen there for those of you watching from home, we've got Cary Ingram, Chief Inspector of Mines and Operational Health and Safety for WSCC. So to get us started this morning, I'm going to invite Premier Cochrane to deliver some opening remarks.
Thank you. Good morning, everyone. Today, the Northwest Territories is in a fortunate position. We're in containment when it comes to COVID-19, and few of our friends in other jurisdictions have ever gotten this chance. In part, we're here because of our public health orders. You only get one shot at containing a pandemic, and you need to take strong action or the situation will get away from you. I'm really proud of the way this pandemic has been handled to date in our territory. But as long as the virus is spreading in Canada, the Northwest Territories is at risk, and we need to maintain our strong measures to prevent the spread. In the past 6 weeks, the Chief Public Health Office has limited travel into our territory, reduced the number of high-risk events in our communities, and put self-isolation processes in place early, separating the high risk from the general population to keep our communities safe. These were strong, necessary actions to get our territory to a good place, one where our most vulnerable and the health system protecting them were safe. But just because people have recovered and the virus isn't spreading right now doesn't mean we should become overconfident. The virus isn't spreading because of the measures we put in place. Public health officers agree that there will be likely a second and maybe a third wave of infection before there's a vaccine for COVID-19. We have to stay vigilant as long as there's a risk to the general public health. I want everyone to keep the significance of this success in mind as we move forward. Because of our Chief Public Health Officer, as she begins to map out a way forward, we must remember that the solutions proposed are based on the best evidence from across the globe and our territory's unique needs. But most of all, we must remember that they are working and that they're keeping you and your families, and all of us, the people that we love, all these measures are keeping us all safe. On that, I thank you again for all that you're doing to abide by the orders. And on that, I'll pass it over to Minister Thom to say a few words. Minister Thom.
Thank you, Premier, and good morning. As we continue our response to COVID-19 across the territory, we find ourselves in a unique position when compared to most jurisdictions in Canada. So far, we have been successful in containing the number of COVID cases in our territory and have avoided any community spread. I'm proud of the work that we have done as a territory to get this far. But containment doesn't happen on its own, and it will not last without careful consideration of all the risk in meeting the challenge of COVID-19. The changes we announced yesterday are geared to address one of those remaining risks, the flow of workers into the N.W.T. who are essential to our territory, those who support them, and the workers advancing critical public infrastructure projects across the territory. The new order includes measures to require self-isolation, reporting, symptom declaration, and regular follow-up on these workers. This is necessary because any workers entering our territory from another location is at higher risk of bringing the COVID-19 in with them. These measures will keep our communities safe while ensuring services and vital projects continue to advance during this crisis. In a larger sense, these measures set the stage for our way forward in this response. As spring thaw begins across our territory, I know many are anxiously waiting for good news on that front. I'm pleased to say by implementing these measures, we will close existing gaps and minimize the risk of COVID-19 coming in from outside our boundaries. And from there, we can begin to consider relaxing some of the restrictions at home. Our team is hard at work finalizing what the easing of measures may look like, and I look forward to sharing it with you soon. I wish to offer my gratitude to the staff on the front line of our response, our public health team, and Dr. Kandola for their tireless efforts to getting us where we are today. And most of all, I would like to thank the residents across the Northwest Territories for making huge sacrifices to keep each other safe. If we keep it up and keep our containment going, it will allow us to ease restrictions and get us re-engaged with family and friends as soon as it is safe to do so. But for now, remember, stand together by staying apart. I would now pass it off to our Northwest Territories Chief Public Health Officer, Dr. Camy Kandola. Kuya Naini.
Thank you, Minister Thom. Today's changes are targeted at essential workers identified under our first order on travel, those supporting them, correction officers, and workers on public infrastructure projects. This has now been expanded to include those infrastructure projects run by Indigenous governments and organizations and municipal governments. The measures here recognize two important realities. Number one, these workers are crucial to our territory's management of this crisis, not just in terms of our health response, but in our broader public health response, of which economic well-being is a key indicator. Two, that these workers do present an elevated risk to our residents, which must be mitigated. There are a few public health values to this. We will be now able to better track and enforce those entering our territory. We are limiting their movement when they are here and setting clear expectations of what they must do both on shift and off shift. And it makes employees and employers more accountable for their actions to encourage compliance with their order. While today may feel like just another day of restrictions, as Minister Thom said, these changes will actually set the stage for a way forward towards looser restrictions. That's because in a pandemic, you are dealing with national and international transmission dynamics. And as a public health professional, I look at the rest of the country and see curves which have not yet peaked. Ideally, we would simply close our boundaries to anyone but residents and those absolutely essential to our territory. But we are not in a position where this is possible. For our health system response to succeed, we need people to come in. And unfortunately, a significant portion of those coming in are coming from jurisdictions where COVID-19 has spread significantly. Implementing these measures and doing it effectively in partnership with the WSCC will minimize our risk and play a big role in readying us to release our restrictions. I want to conclude by saying that I understand these have been tough times for the Northwest Territory residents. These measures are not easy. People I love are living it too. However, to protect our most vulnerable and to prevent our health system from overloading, we needed to move fast at the start to contain this pandemic. And as we now move forward with our response, we need to remember that all this effort could easily be wasted if we let up too quickly. But I do promise you that these measures will not last forever. My team and I are finalizing the plan for a way forward, one which will see restrictions carefully, gradually lifted to bring some stability back to our lives in the coming weeks and months. I do look forward to sharing these plans with you in the near future. Thank you, and I will now take questions.
Thank you, Dr. Kandola. So to our media on the line, those of you who have RSVP'd, thank you very much. As we've done in the past, we will work our way through the list. One question and one follow-up. As a reminder, we have with us Premier Cochrane, who can take questions, Minister of Health and Social Services, Minister Thom, of course, Dr. Kandola, and then on the line with us as well is Cary Ingram from WSCC. So I'll begin by opening up the line to questions, and we'll start with Francis from CKLB. I think you're still muted, Francis. Okay, we'll shift it. We'll try CBC. Alex.
Hi, all. Good morning. This question is directed for Dr. Kandola. So these restrictions relating to closing those loopholes at the border, which you had mentioned, what other loopholes, where do we need more restrictions to really get things as clamped down as they need to be? What further restrictions could we expect?
Heightened border security and addition of this order would be the last restrictions that we need. After this point, if we have very good control of who's coming in and we continue to have no cases, no evidence of community spread, then we can actually move forward and start relaxing some restrictions internally.
So these are really the last measures that we can expect, and if it works, we're in a good place.
Effectively, yes.
Thank you.
Thanks, Alex. Let's turn it over to Michelle at Cabin Radio.
Hi, thank you. I actually have a question that maybe any or all of you could answer. It's in relation to Hay River. As we know, they're making an emergency plan right now for evacuation should flooding happen. And we're wondering for people who are re-entering the N.W.T. and having to go to Hay River to isolate, if they're moving people into the hotels there from the community, do we have plans in place to accommodate people who are returning that need to isolate?
Absolutely. So we've been watching the flooding season is upon us. Our Emergency Measures Act was actually geared towards floods and forest fires, localized emergencies in the Northwest Territories. So we're actively working with the town of Hay River and other communities as well are facing flooding or potential flooding coming on. At this point, we need to continue some of the isolation units for our people that are coming into the territories to keep them out of the smaller communities and the close proximity to the border. But we have a backup plan so that if we need to evacuate some of the people in Hay River that are flooding, we've opened up some of the accommodations in Yellowknife to accommodate them as well. So we're here for the people of Hay River. We're watching it closely, and if need comes, the N.W.T. will assist the community of Hay River to meet the needs of their residents, whether that be evacuation or whatever that may be. Thank you.
Okay, thank you. I have one more question here. Sorry, I just got to get to it. One second here. So the general purpose of the lockdown across Canada was to avoid overwhelming the healthcare system. So this is for Dr. Kandola and Health and Social Services. We've done that really perfectly here in the Territory, just keeping everything to zero now. So in the time that's been bought with the lockdown, what's been done to beef up medical infrastructure and staff to accommodate what potentially could be COVID cases coming in once restrictions are eased up a bit?
So Dr. Sarah Cook is not here to answer, but effectively the Northwest Territories Health and Social Service Authorities, along with Hay River and the Calicho, have used this time to ramp up their response. It's not a time to look back and congratulate itself. It's time to look forward and be prepared possibly for a second and third wave. And so they are still continuing to work, they still continue to meet, and they still continue to ramp up their plans.
Thank you.
Thank you, Michelle. Let's turn it over to Charlotte at APTN.
Hi there. Good morning. This question is for Dr. Kandola. I'm just wondering, since the order, or I guess amendments came into play, how many employers have sought written permission from you to head back to work and not self-isolate, but then follow those other protocols?
Thank you. This order came into effect at 4 p.m. yesterday, and the Protect N.W.T line were receiving calls right away. We have to realize that when we put a new order into effect, that it will, we need to allow employers to have time to review the order and get up to speed. So there's a lot more flexibility within this week to accommodate requests and to provide the support they need. But the order is in effect, and Protect N.W.T is ready to implement it.
And just to follow up, yes, please, thank you. Do you have a rough estimate on how many essential service workers have been coming through the N.W.T since orders have been put into place?
The whole point of putting this order into place is so that we can actually track how many essential service workers are coming through N.W.T. And that was an identified gap, and thank you for recognizing it.
Okay,
Thank
so
you,
there
Charlotte.
was just, thank you.
I just want to remind our viewers at home, I know we've got viewers watching online, CBC is streaming as well, the Cabinet Communications Facebook page is streaming. Should you have some questions, please feel free to mark them down there, and we'll either try to get to them afterwards, or I'll try to make sure we're answering them throughout the press conference today. So I'll now turn it over to Mo at Vista Radio. No? Okay. We'll move through. It looks like Francis from CKLB. Are you on the line to get it working?
Hi, can everyone hear me okay?
Yep.
Perfect. Good morning, everyone. Dr. Kandola, you mentioned there being possible second and third waves of COVID coming. Are these orders meant to prevent those waves, essentially inevitable?
As Premier Cochrane mentioned, we have the fortune, along with a very few other jurisdictions, to be in containment mode. And as long as we don't have community transmission, and as long as we have tight border security, we may be at a position watching other jurisdictions of countries go through the second and third wave. We have to be prepared for a second, third wave, but if we are able to maintain tight control, we could still maintain and contain in our containment mode.
I guess with that being said, if there are a second, third wave of cases coming up to the N.W.T, is it possible that the orders that are in place now are eased and then brought back in? Like, is there a roller coaster, or residents kind of expecting a roller coaster with these orders coming in and out over the next period of time?
So we will be providing more details soon around the way forward. The intent of easing restrictions is phasing restrictions and slowly doing community surveillance, monitoring, and then taking on more higher risk public health measures in terms of relaxing public health measures with higher risk. But we would start with the lower risk ones, and with working with WSCC and having appropriate workplace risk assessments, PPE, IPC measures, infection prevention control measures in place would allow us to ease into these lower risk initiatives with minimal consequence. At the same time, we have to recognize if our risk is mainly the border, the tight control is, an additional tight control is that we're requiring people who are crossing the border to be tracked and logged. And those a mandatory self-isolation, whether you're an essential worker or whether you're a N.W.T. resident or whether you're an adapted workplace plan, every single one who will be in the territory of the next 14 days have to report on day 2, day 6, day 10, and day 14 to protect N.W.T. So we're not only tracking people coming in, we're tracking their compliance and tracking that they don't have symptoms. The whole point is detecting people early, testing them, isolating them, and tracing them. So if we continue having that strong approach, which literally got us through March and April, that approach, border security, will rise again the level of a second and third wave in N.W.T.
Thank you.
Okay. Thank you, Francis. James, Northern News Services, are you on the line?
Yes, I am, but Brockman stole my question, so I don't have anything at this time, unfortunately. Sorry.
Okay, I'll check back with you later if you got one.
Thanks.
Thomas, Radio Tega, are you on the line?
Yes, I'm on the line. Hello, everybody. It's maybe a follow-up on the previous questions. We see the containment plans in Canada. For instance, Quebec will reopen schools. Ontario has a clear containment plan. We know the situation is different here, but people in community are comparing our situation from the rest of Canada. Could you say we are inspired by any of these actions, or could you explain what we are doing differently here and why?
So in N.W.T., we look at our small communities, we look at our remote isolation, we look at the capacity of our health system, and we look at a number of issues that when you look at bigger provinces like Quebec and Ontario, that they don't need to take into consideration as we make decisions for the entire territory. So this approach led me to put in public health measures early and to try to keep us in containment mode, because in our small, highly dense houses in our small communities, it would only take one case to spread throughout the community. It would, if we had to deal with a number of medevacs and sick people, that would put a strain on our hospital systems. If we're putting a strain on our hospital systems and taking up hospital beds and ICUs, we don't have time to resources to be looking at all the other health issues that are happening. So when we look at our unique N.W.T. Northern Remote context, we have to come to a set of decisions that will be different from other provinces.
Okay. Do you feel, do you observe maybe it's getting more difficult for people who are comparing our situation, even if it's for excellent reasons, but is it harder to convince communities, to convince residents of N.W.Ts of the importance of these strict measures?
I think a lot of your questions will be addressed when we move forward, the way forward, or when we're coming in with our transition plan, which is actually looking at easing measures and opening up some restrictions that if the public knows that this is coming and it's coming soon, this should alleviate their anxieties. If not, if they have issues and concerns, they're more than willing to call 811.
Okay, thank you.
Yeah, we're going to go back to Mo with Vista Radio. I believe he's back on the line there.
Hi, yeah, can you hear me?
Yep.
Perfect. First, thank you for taking questions this morning. My question is, so there's a lot of restrictions right now in place, and as we approach kind of as you mentioned earlier, that these are the final wave of measures per se, can you specify to residents of the N.W.T exactly which ones of these restrictions we're probably going to stay in place for a prolonged amount of time, and which ones are going to probably be the first ones in the easing of measures?
Thank you. So any restrictions around border and travel would have to remain in place. As such, the state of public health emergency would have to remain in place. And this would be likely until we get an effective vaccine or antiviral. These measures are the most stringent measures. When you're looking at other measures such as the amendments, mass gatherings, that will be detailed in the way forward. And that is where we can start looking at easing restrictions, and we have more information on that, and it will be given to you soon.
Thank you. I don't have a follow-up question. Thank you very much.
Okay, thanks, Mo. Claudine from Radio-Canada, are you on the line?
Yes, I am. Can you hear me?
Yeah.
Okay, great. My colleague Mario is taken away from us this morning on other projects. So I am just curious. So you talk a lot about some easements coming. Other jurisdictions are, certainly Yukon here is doing that as well. Are those measures regarding the workers, on construction workers, part of this coming up easement? Are we going to see more of similar measures to come?
So thank you for the question. It's all about transmission dynamics. It's all about where is the risk. So in the Northwest Territories, we've had 5 cases, active cases of COVID, 100% all travel related, 100% are now recovered. When we put the order, March 21st order in place, we were very successful for 4 of those cases to contain them because they all went to mandatory self-isolation, and the sequelae of having to do excessive community contact follow-up or any of those scenarios didn't occur. We had minimal. But compared to our first case, when this order wasn't put into place, we had to follow up 70 contacts. And so if we're looking at any measures where we're looking at the risk, and again, if we look at the border and travel risk, if an essential worker is traveling out of territory, they still have to comply. They still have to minimize their risk to other workers and to the public. So those measures are not going to ease up anytime soon.
Okay.
Yep. A follow-up then?
Yeah, perfect. So follow-up would be then what kind of easement measures could we see in the coming weeks? You mentioned you're working on some sort of a plan. So if those self-isolation are not going to change, what could change?
I think this leads in the segue of a new press release, but not right now. And we are in the process of developing that, and we will release it soon. But that's not the purpose of today's conference. But just to let you know that we are actually working on that and providing that detail as you speak. As soon as I get off, I'll be working on it right again this afternoon. But not to be released today, but will be released soon.
Thank you for your questions. So I think that's pretty much all the questions from media, which works out well because we're on a little bit of a tight timeline today. So of course we've got questions online. A lot of the questions we're seeing online today are about, the family bubble, community gardens, all these things that we're basically the restriction easement that Dr. Kandola has indicated is not we're not prepared to speak to that today. So we will get to some of those questions in written format, we promise, but I will not be bringing them forward for response right now. I would like to remind media, though, of course, as always, we have our weekly briefings with Dr. Kandola and Dr. Cook tomorrow. So for media, please feel free to bring your questions forward. We'll see if we can try and get a few more answers for you by then. So we're going to close it off there. Thank you again to media for calling in, for our experts for being here, Cary for being on the line so quiet. Thank you for that. And any follow-up questions, please remember to email presssecretary@gov.nt.ca, and we'll get back to you as soon as we can. So thank you all. Please enjoy the sun this afternoon and have a good week. Thank you.